back everyone. So today I am going to deal with the topic brachial plexus. So moving on to what is brachial plexus. It is a nerve supply to the upper limb and the pectoral region. Introduction. It consists of root, trunk, divisions, cords and branches. So roots. What are roots? They are formed by the anterior primary rami of spinal nerve of C5, C6, C7, C8 and T1 roots. They also form prefixed and postfixed plexus in contribution to C4 and T2. So moving on to what is prefixed or postfixed. Prefixed is contribution of C4. So here we can see that the brachial plexus is started from C5. Contribution of C4 nerve in brachial plexus and absence of T2 is called as prefixed, and contribution of T2 is more and C4 is absent in postfixed. These roots combine to join trunks, as you can see here. These roots combine to form trunks. So moving on to trunk, they are like inferior, middle and superior, are also called as upper trunk, middle trunk and lower trunk. As you already know that roots combine to form trunks. So here it is clear that C5, C6 root combine to form superior trunk or upper trunk. C7 itself continues as middle trunk. The C8 root and T1 root continues to form inferior trunk or lower trunk. So these trunks continues as divisions. So each trunk, each superior, middle, inferior, again divided into anterior, posterior, and anterior and posterior. So divisions or continuation of trunks, and these divisions unite to form cords. So there are three cords: lateral, medial and posterior. This lateral, medial and posterior are related to the axillary artery. The lateral cord is lateral to the axillary artery and posterior cord is posterior to axillary artery and medial cord is medial to axillary artery. The formation of cords from divisions should be quite remembered, focused. So as you can see that from superior trunk we have an posterior division, and from middle trunk we have an posterior division, and from inferior trunk we have an posterior division. All the posterior divisions of all the trunks unite to form posterior cord. All the posterior trunks of all divisions of all trunks unite to form posterior cord. The anterior divisions of here the anterior divisions 1, 2, 3. The anterior divisions of superior or upper and middle trunks unite to form lateral cord. So all posterior divisions of all trunks unite to form posterior cord. The anterior divisions of superior or upper trunk and medial trunk unites to form lateral cord. The remaining anterior division of inferior or lower trunk continues to form medial cord. So this cord, lateral, posterior and medial, gives rise to several branches. So going on to branches, we have few mnemonics like branches from lateral cord. So here we have our lateral cord. And what are the branches from our lateral cord? So here the mnemonic goes like loves me lot, LML. LML. L stands for lateral pectoral nerve, M stands for musculocutaneous nerve, L stands for lateral root of median nerve. Here we go. L stands for lateral pectoral nerve. So here is the lateral pectoral nerve, the yellow one, and musculocutaneous nerve. Here is the musculocutaneous nerve and lateral root of median nerve. Here the lateral root of median nerve. Okay. So moving on to the next cord, posterior cord. So the branches from posterior cord is also having a mnemonic lunar, LUNAR. So here is the posterior cord. Here you can see the posterior cord clearly, posterior to the axillary artery. The posterior cord mnemonic is lunar, LUNAR. L stands for lower subscapular nerve. Here you can see. U stands for upper subscapular nerve. N stands for nerve to latissimus dorsi. As you know that latissimus dorsi is a muscle of back. The nerve to latissimus dorsi is also called as thoracodorsal nerve. So A stands for axillary nerve. Here we can see axillary nerve. Axillary nerve is also called as circumflex nerve. As it passes in axilla, it is called as axillary nerve, and it's taken around the anatomical neck of humerus. So it is called circumflex nerve. And continuation of posterior cord. Posterior cord itself continues as radial nerve. So moving on to the next branch, that is from medial cord. So even medial cord has a mnemonic 4MCU, that is M and 1U. So moving on to the branches of medial cord, that are M and U. Medial pectoral, medial cutaneous nerve of arm is also called as medial brachial cutaneous, because arm is called as brachium and forearm is called as antebrachium. So these nerves can also be called as medial brachial cutaneous nerve and medial antebrachial cutaneous nerve. And moving on to the next M, that is median nerve, formed by medial root of median nerve and lateral root of median nerve. Here you already know that a branch from lateral cord, that is lateral root of median nerve, unites with medial root of median nerve, which is a branch of medial cord, to form medial nerve. It is so called named as median nerve because it passes in the medial plane of hand, and the continuation of medial cord itself is called as ulnar nerve. Two roots. So moving on to the branches from roots, from trunks, that is other than cords. So branches from roots. So as you already know that roots are like C5, C6, C7, C8, T1. So branches from roots are long thoracic nerve, is also called as nerve to serratus anterior, is also called as nerve to bell. The root value is C5, C6, C7. So here you can see long thoracic nerve, which is also called as nerve to serratus anterior because it supplies serratus anterior muscle, and it is also called as nerve to bell. So any damage to this long thoracic nerve leads to winging of scapula, which is a clinical aspect. And branch from C5, only from C5 root, is dorsal scapular nerve, which supplies rhomboidus muscles, rhomboidus major and rhomboidus minor. So moving on to the branches from trunk, only upper trunk or superior trunk gives branches. Middle and inferior trunk will not give any. This is a point where two roots join, that is C5, C6, and two divisions are formed. As you can see, from upper trunk we'll be having anterior and posterior, and we'll be having suprascapular and subclavius. It is called as Eppes point. Damage to this Eppes point leads to Eppes paralysis, which is an important clinical aspect where the site of injury in Eppes paralysis is upper trunk, and the root value is, as you can see, C5 mainly and C6 partially. And what is the deformity? The deformity is named as policeman's tip and Potemman's tip. The deformity of the hand or upper limb will be like in Eppes paralysis is upper trunk, and the root value is, as you can see, C5 mainly and C6 partially. And what is the deformity? The deformity is named as policeman's tip and Potemman's tip. The deformity of the hand or upper limb will be like adducted, that is towards the body, and extension of elbow joint, and pronation and flexion at wrist joint, which leads to formation of policeman's tip or porter's tip's hand. So damage to lower trunk or inferior trunk is called as Klumpke's paralysis. The site of injury is lower trunk of brachial plexus. It may be occurring during upfall of outstretched hand, fall from height during outstretched hands. And root value is mainly T1. Here you can see mainly T1 and partially C8. The muscle paralysis or intrinsic muscles of hand and ulnar flexors of wrist and fingers, you will be more learning in your later classes. And the deformity here we can see is claw hand. So the fingers are in a portion of claw hand where the. So it is a simple diagram of brachial plexus. As you can see, the root C5, C6, C7, C8 and T1. C5, C6 root join to form superior trunk or upper trunk, and C7 itself continues as middle trunk, and C8, T1 join to form inferior trunk. So from each trunk we'll be having upper, lower or anterior, posterior divisions. So all the posterior divisions from all the trunks join to form posterior cord, and the anterior divisions of superior and middle trunk join to form lateral cord, and anterior trunk of inferior trunk continues as medial cord. So the lateral cord having branches, 3 branches, that allows me lot LML, lateral pectoral nerve, musculocutaneous nerve, and lateral root of median nerve. And the posterior cord is also having a mnemonic lunar, LUNAR. L stands for lower subscapular nerve, U stands for upper subscapular nerve, N stands for nautolatissimus dorsi, which is also called as thoracodorsal nerve, and A stands for axillary nerve, which is also called as circumflex nerve, and R stands for radial nerve. And the branches from medial cord is also having a mnemonic, that is 4MU. First M stands for medial cutaneous nerve of arm, and medial cutaneous nerve of forearm, and medial pectoral nerve, and medial root of median nerve. And U stands for ulnar nerve, which is a continuation of medial branch.